My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What? Today we're going to have some fun facts and then we're going to talk about sexual health. Very important subject. Next week you're going to want to come see my other side of the stethoscope. See how doctors react to doctors when we have exams, etc. I think you'll find it interesting and somewhat hilarious. But today I just want to celebrate another day of living. I just want to celebrate another day of living. I just want to celebrate another day of life. Not much of a singer, but I tell you, I do want to celebrate life, and I want you to also, and have a great and healthy 2023, 24. So, some fast facts. Kidney stones. Kidney stones seem to be a big topic of discussion these days. That's when there's too much mineralization, and oxalic acid causes these literally little stones. They're minerals that have stuck together, and they cause tremendous pain in your back, cause nauseated sometimes, and your side hurts. And we're talking like another level of pain, like childbirth pain. It's very, very, very difficult to take, and many of them do not pass by themselves. They'll require medical diagnosis by your healthcare provider, as well as different types of ways of removing them. You also have bladder stones. So inside your urinary tract, you've got your bladder, you got your kidney and your bladder, your urethra. These stones can get stuck anywhere and cause tremendous pain. Again, they can get infected, cause fever, they can cause nausea. They can be really tough, and many don't resolve on their own. So with that said, is there ways you can prevent them? There's a couple ways. You want to avoid a lot of fast food. Has a lot of oxalic acid from fats. Certain colas have it. You don't drink enough water. That's number one. You got to stay hydrated. And if you're on a well, which tends to have a lot of minerals, surface waters, your water supply may be from a surface water. You can find out easily if you look where your water comes from. But your drinking water, if it's a well source, then it would be nice to have some treatment. And the easy way to do that is softener and then your filter like an RO, because you never want your water softener attached to your drinking water, because it'll have way too much sodium. And sodium is another problem. Too much sodium in your diet, which is a problem for many Americans, bad from a whole lot of perspectives, from heart disease to obesity to high blood pressure to kidney stones. So those are pretty easy things to take a look at that you can modify. But genetically, some people are just predisposed. But that doesn't mean you're going to get a kidney stone. It means you have to watch it a little more closely than others. So with that, drink a lot of water. Make sure it's water without a lot of minerals. And make sure you're not drinking softened water, whatever you do. So if in doubt, bottle it out. So with that, a little bit about dental health. Most amazing invention ever. I could never floss my teeth. It'd kill me with flossing, different gaps in my teeth, wide ones, little ones. But you need to floss a couple times a day, brush 3 times a day, and make sure, get something like this, a little plackers or whatever. Get in between those teeth, makes a big difference. Reducing plaque in your gums reduces plaque in your arteries. So not only are your teeth healthier, you avoid gum disease, you avoid things like abscesses, infections, all those wonderful things. Much better bone health in your teeth and gums. Very easy to do, doesn't take a lot of time, and pretty inconspicuous with the plackers. In addition to that, I've said before, good old hydrogen peroxide. I'll tell you, this is fantastic stuff. Get it at your local grocery store. This happens to be a Walmart brand, I believe. 3%, it says right on it, for dental debridement. Don't use a fancy mouthwash. You can use this hydrogen peroxide. It whitens your teeth. It promotes gum health. You swish it around in your mouth. You don't have to gargle it. Swish it around in your mouth for 30 seconds. Spit it out. Sometimes it takes a little getting used to, but it won't hurt you. then rinse your mouth out, and you're going to have fresh breath, whiter teeth, and most of all, you're going to kill the bacteria inside your gum line between the teeth that causes gum disease and can cause hardening of your arteries. Really simple, super inexpensive. For 32 ounces, about $1. Lasts a long time. Good for everything, and if you get a bad cut or something, it's a lot less irritating than the iodine or some different alcohols, and it can be very good for wound cleaning. So great stuff to have around the house. Last fun fact, skin and hair. Okay, skin. This time of year, again, avoid sun exposure. Keep the sunscreen on. Wear sun protective clothing. That's even better. Make sure you use lotion, especially before you go to bed or after a shower or bath. A decent, all the lotions are relatively good for you. Those drugstore brands that don't cost a lot work really well. Drink a lot, as we just said. Being hydrated is really important. And when I say drink a lot of water. Drink things without sugar, and it'll really help you. If you need protein, drink a lot of milk. If it doesn't bother you, not lactose intolerant, it's great for you. Watch the soaps you use. You don't want really harsh soaps to be used on your skin. So when you take your shower or bath, just make sure you don't rub the skin off either. Gently wash yourself. Use a reasonably non-aggressive shampoo, and that will help your hair. Body washes are great, but you have to read the ingredients. Be careful you're not putting something on your skin you don't like. You can have allergies to different ingredients, from your laundry detergent to your soaps and shampoos. So if you start getting any kind of rash or anything, you need to have that looked at by your healthcare provider. If it's a simple allergy, you can really remove that, narrow it down, and avoid those kind of complications. Dry skin's a real problem in the winter or when the humidity's low, and to keep that lotion on, you'd be surprised at the difference it makes. And when you go onto that too, make sure your feet are dry. And if your feet sweat a lot, make sure you change socks or have open air shoes on a regular basis. You don't want to get fungi, like you don't want to have problems with foot fungus, nail fungus, all those things. Really hard to treat sometimes, athletes' feet. So you want to, that's not too bad, but you want to look at the treatments if you have them, but you also want to make sure you keep your feet clean and dry. Really important. And with hair, I'll say the last thing is coloring your hair. Oh my God. If you're looking to have hair, which I don't have much, but if you have hair, man or woman, just remember, every time you color your hair, that hair is being damaged. I don't care how gentle it is. And if you're having your hair straightened, you're breaking the sulfur bonds in your hair. You're really being hard on your hair. That's why people's hair looks like a bird's nest when it gets all fried and burnt at the ends. Or if you're using a blow dryer that's really too hot, and I would just recommend, if you can get away with it, not using a blow dryer at all. Really hot curlers, you got to watch all that. Remember, this is an extension of your skin, and you're just ruining it. And over time, you just thin your hair out so badly, and you're going to make your hair lose its sheen. If you see young people that don't mess with their hair, they're 19, 20 years old, man or woman, they just got beautiful sheen to their hair. If you're well nourished, it's a wonderful, wonderful thing. Now with that, we will go to sexual health. There's physical, emotional, mental issues, as well as safety issues. First and foremost, be careful. In this day and age, you have to be careful for a whole lot of things. People will tell you anything, especially if they want to get in your pants. So you have to be careful. Assume what they tell you may or may not be true, but it's like a salesman. They could be pretty aggressive, male or female. Anyone you have sex with, unprotected sex, you're having sex with everybody they've had sex with. And I say that because we're biological beings. We are incubators of disease. So if someone, and a lot of people will have a sexually transmitted disease and not know it. Old school syphilis. You can have for 30 years and not have symptoms, and all of a sudden that's what Napoleon died of, from heart disease, syphilitic heart disease. So you want to be careful, and you want to be tested at least once by your healthcare provider for those general infections such as chlamydia, gonorrhea, syphilis, then obviously if you've had unprotected sex, I don't care who it's with, you need to be looking at being tested for HIV, which can develop into the disease AIDS, autoimmune deficiency syndrome, life-changing event. But there's others that 90% of the population is estimated to have HPV. That's human papillomavirus, which can cause genital warts and other issues, as well as some cancers. You need to be tested for all those things. Best way to avoid all that is just not have unprotected sex. Limit your number of partners. Ideally, the less the better, because the chances are, as careful as you can be, you still can have exposures. And a good example of that is people will have protected sex with a condom, and then they'll have oral sex with no thought at all that your lips, your mucous membranes, your eyes, your nose, anything that touches those infected mucous membranes of that person can cause you to have a sexually transmitted disease. So if you insist on oral sex with someone that you know is not your long-term spouse or partner, that you need to have an oral dam. Sounds really sexy, doesn't it? But some kind of protection, basically an oral condom, if that's the route you choose to go. But again, any and all unprotected sex, or those with partners that you're not sure of and they're not monogamous with you or haven't been tested, there's some risk that you can have a sexually transmitted disease. And I say that because school's back in session, colleges are there, a lot of new friendships, nothing wrong with friendships, but you need to be extremely careful. Your body can get some diseases that are very difficult to deal with and life-changing in some instances just for a quick fling. So you need to really carefully consider that. And then there's an emotional component that a lot of people think relationships are something they are, and they're not. They're not viewed the same by two people. And that can even happen in long-term relationships. And you need to be careful to protect your emotional health. And, you see so many people that are so torn up, broke up. He didn't love me, I thought he did. She didn't love me, I thought she did. Those things can be really devastating. The more involved you are, and certainly if there's a physical component, it can have an emotional component. There's a spiritual component, whether you believe, whatever you believe about that, but there is a deep spiritual connection, and those kind of things can really wreak havoc on your mental and spiritual health, emotional health. Physically, as I said, it causes all types of diseases. Now, there's some wonderful, wonderful, wonderful health aspects of good, healthy, long-term partnered sex, such as long-term committed marriage. First, you got to be compatible. You have to have both about the same drives. And drives change over time with hormones, stress, fatigue, etc. You need to set aside time to have intimacy in your life with your partner. And that means that you need to make it a priority. People say, I want sex to be spontaneous. You have to schedule it. And schedule it when you're relaxed, you're well nourished, you're hydrated, you've slept enough so that everybody doesn't have performance issues or anxiety issues or drag those things that your daily work problems, school problems, or whatever into the bedroom. That's not good at all. But if you do have that, you can lower your heart attack risk, especially for men. You can cut it in half with regular sexual activity. And that's a big deal. It increases men and women's immune system. Good, healthy sex releases a set of hormones that help your immune system function well. The endorphins you get and some of the other things are shown to be extremely beneficial. It lowers depression. It relieves stress. All those things are wonderful that help you every day to decompress. And what better way to decompress than sex with your mate? So blood pressure, you can lower your blood pressure, which is another wonderful thing. And believe it or not, it can cause you to lose weight, because many times obesity is a complex problem. It boils down to the simply eating more calories than you put out. But it also can have hormonal effects that make you feel hungry or make you feel the need to eat, or make you to feel some emotional deficit by eating. And good, healthy sex life prevents all that. It helps women a lot with bladder control as you get older. And I'm not talking about old. I'm talking about, you could be in your 30s or 40s, and as your pelvic muscles loosen and bladder control can become an issue. Healthy sex, the contraction of all those muscles during sexual activity is very beneficial. Flexibility, it is a form of exercise. Now, it's not going to take the place of a gym unless you plan on having an awful lot of sex for an awful lot of time, but it helps with flexibility because it's positions that are very highly motivated that you want to be involved in and that you don't normally contort yourself in. So that's a good thing. For men, it can really reduce the risk of prostate cancer and prostate inflammation. Unprotected sex can cause you to have infections or inflammation in your prostate, which you'll get one time and you'll wish you'd never got before. It's sometimes very, very hard to treat. So with all that, I'd like to say, this is Dr. Frank with My Doctor Said What? I hope you enjoyed dementia last week and talking about cancer the week before. But next week, like I said, is going to be the other side of the stethoscope. I think you'll find it fairly amusing. It's going to be on my TikTok this week, in Facebook and Instagram. Thank Dr. Frank, My Doctor Said What, on YouTube, and on all major platforms podcasting. So I'd ask you to check it out and have a great day and a wonderful, healthy 2023. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.